This Good to Go segment is sponsored by Corewell Health.
According to the American Lung Association, more than 34 million Americans live with a chronic lung disease like asthma or COPD, which includes emphysema and chronic bronchitis. Helping these individuals lead better, more fulfilling lives is the goal of Corewell Health's Pulmonary Rehabilitation program. Dr. Kevin Patterson is a pulmonologist here to tell us more about the help that's available for people with lung disease. Hi, Dr. Patterson.
Hi, good morning. Thank you so much for having me.
Oh, glad to. I mentioned a few of the diseases that affect a person's ability to breathe, but can you give us a better idea about the types of patients you see, their ages, the problems that they may have?
Yeah, absolutely. So we have a wide range of patients that come to see us, anywhere from 20s to 80s, with the majority of people being in their 50s to 70s. We see a wide range of chronic lung diseases from asthma and COPD, like you talked about, but we also see pulmonary hypertension, chronic pulmonary fibrosis. We see pulmonary hypertension, bronchiectasis, so quite a wide range there. The majority of symptoms that we see are shortness of breath, but we also see chest tightness, chronic cough, people that have oxygen requirements, inhaler requirements, fatigue, and deconditioning being the big things that we see.
Many years ago, I think a lot of people who suffered with these kinds of illnesses, or at least some of them, would have been told, just avoid exertion as a way to live with that condition. How have things changed over the years?
Right, so it's important to recognize that exercise is good for us. Many years ago, providers thought that people with chronic lung disease would be too ill to participate in meaningful exercise, but we know that that's wrong. We know through many years of research that it's greatly beneficial for people with chronic lung disease to participate in exercise. So, we're not asking people to run a marathon during pulmonary rehab, but we do have an initial evaluation where our highly trained exercise physiologists, respiratory therapists can create a tailored exercise regimen for each person. We have a wide variety of exercise equipment, from treadmills to recumbent bikes to arm cycles and more. We do weights and stretching exercises. And then if people have limitations like knee pain or back pain, we can usually make some accommodations. And so we know that an exercise program about 6 to 8 weeks in length with 2 to 3 exercise sessions and exercise in between can greatly help jumpstart people's road to recovery.
At what point should someone who's dealing with some kind of a condition, a breathing problem, speak to a medical professional, and who should that be?
So if you have a chronic lung disease and you're struggling with shortness of breath or other respiratory symptoms, you can talk to your primary care provider and they can refer directly to us. Or if they have concerns or they're not sure how to do that process, they can refer to our Corewell Health Pulmonology group, and we'd be happy to evaluate.
Are there more resources available that we should tell folks about?
Absolutely. So in our pulmonology, pulmonary rehab program, we have quite an array of classes. So we have classes on breathing techniques, cough management, inhalers, nutrition education, and living with chronic lung disease. And then also our pulmonology group would be happy to see any new patients with chronic lung disease and symptoms related.
National Pulmonary Rehabilitation Week is observed this year from March 12th to the 18th. What message would you have for folks who struggle with chronic lung disease?
So I'd say that we have an amazing pulmonary rehab program. We have a talented and caring staff who's ready to help those in need. So if you're struggling with shortness of breath, difficulty with chronic lung disease, we'd love to see you. We'd love to get you back on your feet and moving again.
Very nice. Okay. For more information, visit spectrumhealth.org/services/pulmonology. You can find a link to that at 13onyourside.com. Dr. Patterson, thank you.
Thank you so much.